Just a couple of quick questions about, mainly about the memorial homes. What is the status and the specific duties of the federal monitor overseeing the Paramus and the Menlo Park Veterans Memorial Homes?
Thank you for the question, Assemblyman. Following a September 7th, 2023 report that was issued by the U.S. Department of Justice, the state of New Jersey worked in concert with the federal government to develop a way forward for Menlo Park and Paramus. Particularly, that report identified shortcomings that occurred during the first wave of the COVID-19 pandemic. COVID-19, as we all know, presented challenges for long-term care, unlike any other. And as I visit the facilities on a routine basis, I'm often reminded that many of our nurses, LPNs, registered nurses, social workers, these folks work themselves through the pandemic, and I'm very proud of that contribution that they have made and continue to make. Following our agreement, which we reached in the end of 2024 with the federal government, we entered into an agreement where a monitor, the Hibiscus Group specifically, would conduct unannounced, no-notice visits at our facilities to evaluate a certain set of criteria that was established in the agreement with the federal government. Hibiscus Group is, again, on the ground routinely. Today, they arrived at Paramus on Saturday because they wanted to see some weekend operations. And today, I believe they're in Menlo Park. We have a constructive relationship with the Hibiscus Group. We listen, we implement their recommendations as appropriate, and I believe that it's been positive, not only for our employees in the homes, but for the residents. As I noted in my testimony, just one other clarification. The homes are ranked by the New Jersey Department of Health, acting as agents of the Centers for Medicare and Medicaid Services, as 5 out of 5 stars. That can only be the top 10% of long-term care facilities. And the first component of that 5-star ranking is performance on independent inspections conducted by DOH, no notice. Those are comprehensive surveys, those are infection control surveys, and complaint-based surveys. And so while we have always room to improve and work to do, I'm very pleased with the progress we have made that has been reflected in the results of the DOH surveys that are conducted on a regular basis.
Okay, has there been any noticeable, tangible improvement in the conditions and the quality of care for the residents that you can attribute to the monitor?
Oh, I would attribute, the more eyes the better. And we view them as colleagues. They're professionals who have certainly added value in Menlo Park and Paramus. And again, if we're looking at that measurable increase in the quality of care that we provide, in January of 2023, I was asked to become the Deputy Commissioner under Major General Howe. The Menlo Park Veterans Home was rated 2 out of 5 stars overall. And since that time, we've achieved 5 out of 5. And that does not happen by accident. It happens because of investments made in previous budgets. There was a series of statutory reforms passed by the legislature in 2021 that have really enabled us to do better with clinical leaders, et cetera. And again, didn't happen overnight, but I'm really proud of the 5-star performance across the system.
Now, that is pretty impressive. Is there a timeline for the sunsetting of the monitor and the transfer of oversight back to the department?
There is not a timeline, and in terms of the defining the relationship, yes, they are providing oversight as another set of eyes, but management of those facilities remains with the state of New Jersey. It's our professionals who are running day-to-day operations, implementing policies, and again, we welcome the feedback of Hibiscus Group, but that relationship will terminate when mutually agreed upon by both of the parties and when the state has met certain criteria within the agreement. And we have not met all of those criteria at this time.
Okay, and as far as any specific recommendations that the monitor may have provided with you, could you name a few of the recommendations? And also, does the FY27 budget adequately support those recommendations?
Yes. So the monitor provides us with informal recommendations on each visit when we do an outbrief. In addition, they've provided us written recommendations. Some are more easier to achieve than others. And some, quite frankly, like I said, it illustrates my point that we welcome their feedback. Early on, they identified in one of the facilities that they anticipated what they called an issue with paper compliance. And they felt that people were not, like all humans, looking at a form, and it might have just been a check-the-box exercise. And the monitors met with us, and I said, well, show me the evidence. And they said, well, it's difficult. It's just what we're observing, et cetera. And in that case, we conducted staff retraining. We've worked to make sure that we're no longer just checking a box, that folks are thinking critically about the forms that they're filling out. And in addition, I think this is probably much more relevant in terms of patient care. They identified a gap in one of our policies where a patient, if he refused or she refused, I believe in this case it was a he, if he refused his medication, how long did we wait to notify the patient's physician? And so there was, in 2 out of 3 of our homes, we were doing exactly what the monitor would want, but in one, they identified this issue with policy that we corrected, wrote a new policy, did staff retraining, and it's discrete items like that that I feel they've added value.
Okay, and you're looking at the proposed budget now, do you feel there's enough funding in there to underwrite even the other recommendations that they may have given you along the line?
As of right now, yes. And I would note that many of us are aware the governor asked agencies early on to identify cost savings and reduce operating expenses. Thankfully, Governor Sherrill, who is the first and only woman veteran to have ever been elected governor of a state or territory in United States history, exempted our agency, the Department of Veterans Affairs. In addition to that, this budget increases operational funds for the veterans' homes by roughly $10.5 million, and we're very pleased with the budget that we're presenting.
Okay, it sounds like there's adequate funding as of
Yes, sir.
at this point. And last question, has the department established the required office for a veterans advocate, and has a veterans advocate been hired?
As you point out, in 2020, calendar year of 2025, the legislature enacted a statute to establish an office of the Veterans Advocate. At this time, that appointment has not been made by the governor. It's subject to Senate confirmation, so the short answer is no. However, I will say this. Each of our veterans memorial homes, in addition to the positive news that I shared, have full-time resident advocates, and that's a result of laws that were passed in the legislature in 2021. So 5 days a week, sometimes 6, a family member or a resident can bring a concern or talk about their care with a trained resident advocate in our homes.
Okay, so that would satisfy what the statute calls for?
No, sir. That statute is separate, and we are waiting
Okay.
on the governor to make that appointment.
Okay, that's it.
Yes,
Thank
sir.
you, Commissioner.